As for little Max, the diagnosis path was for the first 3 years of his life, and he lived with a different diagnosis. But in fact, his illness started in his first weeks, because it was then that he got his first bout of pneumonia. We ended up in our district hospital. The district hospital discharged him. He seemed to be cured, but after a couple of days, we ended up in the regional hospital. And there he was treated for inflammation. The first treatment was quite long. We went home, and it seemed to me that everything was okay. But 2 months afterwards, there was another bout of pneumonia. In total, in his first year, he had pneumonia 5 times. Bacterial pneumonia, which repeated itself, as he had staphylococcal pneumonia and mycoplasma pneumonia and pneumococcal, as well as streptococcal pneumonia. At some point, when he had his test done, it turned out that he had an enlarged liver. The GP referred us to our first major district hospital, and Max's diagnosis was alpha-1 antitrypsin deficiency, because his liver enzymes were lower all the time. And then we were sent to the Child Health Care Centre. For the first time, Max was at the Child Health Care Centre when he was 6 or 7 months old. We used to go to various clinics for various tests, and all the time his diagnosis was alpha-1 antitrypsin deficiency. That is, the doctor said that it might be because his results were not necessarily genetic deficiency, but it resulted from some organ or body immaturity. So this is how we learned that Max had IgG subclass deficiency. At present, Max has grade 2 reflux diagnosed. Besides, he has problems related with his disease, because he tends to have an enlarged liver, spleen, and issues with his eyesight. But I think that is not his greatest problem. Earlier, he had some murmurs in his little heart, but now everything is all right with his heart so far. Max has had pneumonia 13 times, which had to be treated in hospital. All the time I thought my child would die, and that he wouldn't survive another case of pneumonia, because there were moments when he looked really dreadful. As I watched my child suffocate, turn blue in the face, and see one case of pneumonia finish, and then another case would start, and I would simply go mad. I have had a very hard time to take it in, and some time ago someone asked me quite a difficult question: whether he would die from the disease, or would the doctors be able to help him. When he is healthy, he does everything normally. He does everything normally like any other normal and healthy child. He is very active and is very lively, sometimes too lively. He loves playing football. He can ride a bike very fast. He doesn't talk about his disease every day, but he knows that when the time comes and we have to go, then he packs his things for hospital. He takes his storybooks and says, "Mum, are we going to hospital? And when are we going to leave?" Sometimes it's even more difficult given his veins. Sometimes to insert a cannula is a very long and difficult process. Nurses have to inject him 4 or 5 times to insert his cannula, which is a problem because he cries and he doesn't want this anymore. But the stays in hospital themselves or in the clinics are something normal for him. He doesn't disagree. He knows why we are going, and we will come back, so it will still be normal.